Union Test Prep's CNA Clinical Skills Practice Test. Question 1. Which of the following is a good technique for obtaining an accurate blood pressure? A. After inflating the cuff to an appropriate pressure, rapidly deflate it at a rate of 8 to 10 millimeters of mercury per second. B. Position the patient's arm below the level of the heart. C. Encourage the patient to talk to make them feel more comfortable. D. Watch the needle fall 10 to 20 millimeters of mercury past the last time you hear a sound. The correct answer is D. Watching the needle fall 10 to 20 millimeters of mercury past the last sound you hear will help ensure your diastolic value is accurate. Now let's explore why the other answers were incorrect. The blood pressure cuff should always be deflated slowly and completely at a rate of around 2 to 3 millimeters of mercury per second. The patient's arm should be placed at the level of the heart, and the patient should be quiet during the blood pressure reading, as talking could increase blood pressure slightly. Question 2. Which adult pulse rate should be reported to the nurse? Select all that apply. A. 122 beats per minute. B. 58 beats per minute. C. 66 beats per minute. D. 91 beats per minute. A normal resting pulse rate in an adult is between 60 and 100 beats per minute. Pulse rates of 58 and 122 fall outside normal range and should be reported. Question 3. Which thermometer type produces the most accurate reading in young children? A. Rectal. B. Oral. C. Tympanic. D. Axillary. The correct answer is A. A rectal thermometer. Axillary, or armpit temperatures, are typically considered the least accurate of all thermometer types. Oral readings are considered accurate in adults, provided they are used properly. For more free practice questions, study guides, and flashcards, please check out Union Test Prep's CNA study material at uniontestprep.com/CNA.